Good morning and welcome to UroNurse. You know the drill. Today we ask a critical question for the future of healthcare. Which AI gives the safest medical advice? This week, the independent clinical AI research group known as ARISE, A-R-I-S-E, released a highly anticipated No Harm version 2 study. Led by physicians at Stanford and Harvard, this report sets a new standard for evaluating artificial intelligence in medicine. Unlike traditional medical AI benchmarks that simply test a model's performance on multiple choice questions, No Harm evaluates something much more important: whether a model's recommendations could actually contribute to patient harm. Now, this rigorous benchmark was developed by a massive team of more than 50 researchers, including 29 board-certified physicians. Together, they put these AI systems through 1,100 realistic clinical case scenarios. And now here's the results. In real-world testing of commercially available products by physicians, Doximity Ask received the highest score at 75.8%. It was followed by ChatGPT Health at 68.4% and Open Evidence at 60.8%. The study found that specialized medical AI systems perform very well with natural prompts, meaning the way questions actually arise in everyday clinical practice. While general-purpose models like ChatGPT or Gemini could improve their answers with careful engineering prompts, they still did not match the performance of leading specialized medical systems. Doximity Ask, for instance, is designed to provide reliable guidance without requiring doctors to use special prompting. Another major revelation from the study was the consistency test. Researchers wanted to know if these models gave consistent guidance when the underlying clinical problem remained exactly the same. To test this, they made a small, clinically irrelevant edit to patient scenarios. For example, changing a patient's age from 71 to 73, and then look for changes in the AI's output. The findings were striking. General-purpose models were substantially more likely to vary their answers based on these tiny edits. However, specialized systems like Doximity Ask were less sensitive to these changes. So, what's the bottom line here? If the medical facts haven't changed, the system's conclusions shouldn't change either, right? Beyond the rankings, the study consistently proved that clinical performance requires far more than just general language ability. AI recommendations must be stable and deeply grounded in underlying evidence. But technology isn't perfect. Every system evaluated in the study had measurable gaps. Doximity's head of medical AI noted that the right response to these shortcomings is to measure them, make them visible, and keep improving. For Doximity, this improvement is powered by their Peer Check program, where more than 11,000 physicians help refine the system every single day. Ultimately, we have to thank the ARISE investigators for raising the standard on how clinical AI is evaluated. Independent, safety-focused evaluation doesn't just benefit tech developers, it benefits physicians, health systems, and most importantly, the patients whose lives depend on safe, reliable care. Thanks for joining us on UroNurse News. I'm Vic Senese. Have a great rest of your day. And this Saturday on UroPatient, at UroPatient.com, prostate MRI is explained, a step-by-step guide. Has your doctor recommended a prostate MRI? Wondering what the scan is like, how to prepare, or if it will hurt? This Saturday, I'll walk you through the entire process, from checking in for your appointment to what happens during the scan and what your doctor's looking for. You'll learn why prostate MRI has become such an important tool for detecting prostate cancer and planning the next step in your care. So whether you're having your first MRI or simply want to know what to expect, this episode will help you feel informed and confident before your appointment. Hey, tomorrow on UroNurse News, did you know the FDA has approved Lipfendra, Merck's new oral cholesterol medication? Well, I'm going to break down what healthcare professionals and patients need to know. Who is Lipfendra for? How does it lower cholesterol? Where does this fit in among all the other treatment options? What questions should patients ask their doctors? Tune in tomorrow to find out.
Join us every Monday through Friday at 9 a.m. Central Time.
UroNurse, where the experts meet. Online learning, practical and sweet. Every Saturday, 9 a.m. Central Time. YouTube, Facebook, X, and LinkedIn. Online.